us. This is Mental Health Community of Hope, our May meeting. And so I'm going to give just a couple of minutes for some folks to jump on and join us before we actually get started. So just hold tight. If you're already on and watching, then we're glad to have you. Leslie is joining us, the other face that you see, from somewhere near a lake. And so she's taking precious time out of her day to join us for this discussion today. So I appreciate it, Leslie, and I'll do your formal intro in just a minute once we get another couple of people to jump on and be watching. And if just so you know, this will be still present on Facebook after we're finished, and so folks can go to that and listen to it again, or get some of the resources that we may talk about during this live event. And so you will be able to access it even after we're finished today. We're going to talk probably for about 30 or 40 minutes, just so you know kind of how to plan. And so, all right, I'm seeing 3 o'clock. And so what do you think, Leslie? Go ahead and start.
Sure, I think intros and just some explanations, and then that way people can come on.
Okay, perfect. So I'm Terry Lee. I'm the founder and executive director of Overflow Foundation. And just in case we have some listeners or some viewers today that are not familiar with Overflow Foundation, I want to tell you just a little bit about it today as we get started. Overflow Foundation is a 501c3 nonprofit organization that was started in memory of my son, Philip Lee Jr., who died by suicide about a year and a half ago. And so Overflow was the name of Philip's first EP music release. Philip was a professional singer-songwriter. And Overflow was the name of that first EP. And so Overflow Foundation is a continuation of the astronomical effect that Philip's life had on so many people. And now that we are asking God to use also his death to reach people who are hurting and who need to reach out for help and hope. And so the mantra of Overflow Foundation is #Feel, which does stand for Philip, but it also stands for pouring hope into life. And so this nonprofit organization strives to promote mental health and promote suicide prevention, as well as provide mental health education. We're trying to raise awareness through this organization, and we're trying to decrease stigma and provide people with hope and resources that will help them simply take another day and hang in there and keep stepping one moment at a time, one day at a time. So it is a painful journey for me on some days. We are still very much in the grief of the loss of our son, but we're asking God to use the pain for purpose, to be able to reach other people who may be hurting. And so I'm finding that God is strengthening us one day at a time and directing the work of the foundation as we move in this. And so thank you for giving us a little bit of time this afternoon to talk about a very important topic. Today I've decided that we're going to talk about child and adolescent mental health. I've gotten a lot of emails, phone calls, texts from parents who are struggling, who are concerned about their children and teenagers in the context of COVID-19, but also just in the context of life. They're concerned about whether or not their child is struggling, whether or not what they're seeing is normal or abnormal. And so we just want to crack the door a little bit and provide some information and some helpful resources to you as parents regarding childhood and adolescent mental health. And so today I have Leslie Addison with me. Leslie is a licensed professional counselor. She has over 16 years of experience in child and adolescent therapy. She's done she's doing private therapy. She does family therapy. She received her master's degree in clinical psychology from Georgia Southern. And so Leslie, tell us a little bit more about your work as we get started today.
Yeah, so for the past 16 years, I started out in Georgia in a very small town called Swainsboro. I worked as a child and adolescent therapist at the mental health clinic there. And I think it was the most wonderful way to get my feet wet. As a new therapist, I saw all kinds of situations from very serious to very just kind of normal growing up, kind of growing pains, mental health situations. I got really, really great training at that first job. And from there, I was offered a wonderful opportunity to go work at a children's shelter that was opening up in Georgia, in Dublin, Georgia, called the ARC, Area Residence for Kids. And it was a short-term crisis shelter for DFACS kids in Georgia. And our specialty was that when kids were picked up by DFACS in an emergency situation, we could house large sibling groups together. So that way they didn't have to be split into 2 or 3 different foster homes. And so at any given time, we could have 16 kids total, and some have 5 or 6 that were siblings of one another. In some instances, we even had like an older sibling that may have already had their own child, and we were able to keep them together as well. So that was a wonderful opportunity. It was a Christian organization, a nonprofit Christian shelter, and I had such an amazing experience there for almost 4 years. The last, goodness, almost 13 years now, I've been at Aurora Pavilion Hospital in Aiken. We are a short-term crisis hospital. We do serve kids and adolescents, but we also have 2 adult units and a geriatric unit as well. My primary home base is the child and adolescent unit, and that is where I do probably 75% of my work, but I also get the pleasure of going to the other units and leading in group therapy or in family sessions on those units as well. So,
Okay. Well, it sounds like you bring a wealth of experience to the table today for our discussion. It's interesting. Most of my clinical experience in nursing for the last 35 years has been clinical nursing, mostly in critical care or in quality outcomes management. So it's not really been in psychiatric care. And not until Philip's death did I become a mental health advocate as a mom and as a nurse and as a pastor's wife. So in all of those areas of my life, am I working in mental health advocacy now? And so I've exposed myself to the mental health first aid class and to a lot of the literature out there on mental health, and also to the National Council for Behavioral Health, to the information that they put out there. And I know based on the National Council for Behavioral Health that about 20% of the population, let's say we're talking about children from the age of 7 to 8 to 18. Is that a good demographic to include in our conversation today?
That demographic that I would say that I serve on a regular basis.
Okay,
yes.
perfect. So the percentage, according to the National Council, Leslie, is that about 20% of children and teens or adolescents in that age group may be diagnosed or will be diagnosed within any given year with a mental illness or a mental challenge or disorder. I'll use all of that terminology interchangeably. And so the first thing I really want to kind of do is get you just to address for the parents, okay, how do we know that what's the difference in someone who is mentally healthy and walking through life without any of those struggles, as opposed to someone who may be developing a mental health challenge? Help us with that.
So what we talk to parents about is they know their kids better than anyone else. And when you begin to notice changes within behavior or mood, that's when you start needing to be more aware of what's going on in your kid's life. Are they having difficulties with sleeping? Are they having trouble going to sleep, staying asleep, or even with nightmares? That's something we've been encountering more with COVID, and I'll talk about a little bit later. Another thing is appetite. Now, of course, kids' appetites are going to change day to day because of growth spurts and things. But if you really start noticing, especially teenagers not eating as much or binge eating, that can definitely be a sign. Changes in not having interest in anything at all. Now, kids and teenagers are going to change what they're interested in day to day, even, but not having interest in anything. So, if your kid used to be outgoing and going to sports and having fun with friends, and now all they want to do is lay in bed, those are definitely signs. So, losing interest in things. You may also notice a drastic change in their school performance. That's not to say that all kids are always going to have all A's, but if your kid has been an AB student their whole life and all of a sudden they've got several C's or D's, that's a red flag that there may be something going on with their mental health stability. So it's really looking for those noticeable changes in your child. And I tell parents all the time, I can do not necessarily test, but rating scales on a kid and all that. But my best source of information is their family, because they know their kid better than anyone. And they know if this normal behavior for their child or if it's behavior that needs to be concerning and needs to be discussed with a professional.
Okay. Fantastic information. And so one of the things I'm hearing now as a mom, I'll put my mom hat on for just a second, is in raising our kids, oh my goodness, we saw that they want to sleep all the time anyway. Teenagers like to stay in bed till noon sometimes anyway. They go through eating spurts where you cannot keep enough food in the pantry or in the refrigerator. And so I think looking at the inability to live, laugh, love, and learn, those things that you're talking about, maybe over a period of time, would that be the qualifier for you, or what would raise a red flag for parents?
Yes, 2 to 4 weeks is really what we're looking for. If a person calls their pediatrician or a counselor and says, my child's been having trouble for 3 days, that person tell them, let's just see what's going on, because kids have just got to process things in their mind sometimes. But yes, if they're losing interest in things that they enjoy, if their mood is drastically changing, if their behavior is drastically changing, or if their sleep and appetite is drastically changing for 2 to 4 weeks,
Okay.
that's the period that we talk about. Yes.
Okay. Fantastic. So that gives parents a little bit more qualifying information, so that they know kind of what to watch for. Let me think for just a second. So let's put this then in the context of COVID-19 and the fact that you're there at Aurora and also in private practice too. We'll talk a little bit more about that at the tail end of this, but tell me what you're seeing on the rise in relationship to COVID-19, and then even outside of COVID-19, what are the most prevalent mental health disorders or challenges that you're seeing children and adolescents deal with inside and outside of COVID-19?
I think that inside of COVID-19, the most prevalent one we have seen a rise in is generalized anxiety disorder. And generalized anxiety disorder is often called GAD, G-A-D. And what it is when a person is having overwhelming thoughts of worry or nervousness. Again, we all have a little anxiety going on about this crisis right now.
Right.
But when it is beginning to affect how a child eats and sleeps and interacts with their family, and of course, right now it's difficult to interact with friends, but if they're not wanting to go on the phone or on the Zoom calls and talk to their friends or whatever, those can be definite signs. We've seen a high increase in nightmares, as I mentioned before. And as a mother myself of younger kids, I have noticed a lot of talk about the germs and the germs being scary. And my 2-year-old, who's almost 3, doesn't understand that the germs are not going to be on things like butterflies and not going to be on things like the dirt outside. And so she has even struggled because she's been stuck at home for 9 weeks without leaving the house until this weekend. Where, even just going outside, we've really had to make her feel safe.
Okay.
We've seen a huge rise in generalized anxiety disorder, and I've noticed it at the hospital and in private practice. The other thing that I think is going on right now, a lot of, is major depressive disorder, and that's a little bit more serious. It kind of goes up on the scale where a lot of times, if you notice something going on for more than a month, you may want to again start considering a medication possibility. And that's where you do start having the thoughts of suicide often, or thoughts of hurting themselves, which those are two different very things. We see teenagers now that may want to hurt themselves but may not want to die. And those are two different things, but they both qualify under major depressive disorder. If there's ongoing sadness, ongoing depression, ongoing loss of interest, those definitely low energy, irritability. That's actually a very common symptom in teenagers, is irritability. And I know all teenagers are irritable, but ongoing irritability to where it's affecting their interaction with teachers and other grown-ups, maybe than just their mom.
Okay.
So for the biggest ones that I've seen on the rise, I think, recently.
Okay. And so is that in line also then with, outside of COVID-19, those mental health challenges are the same before all of this stuff started? Those are the most prevalent ones for teenagers and for children?
Anyway, yes, along with, I would say, ADHD, which we're probably all familiar with. And then one that people are not quite as familiar with is ODD, but it's oppositional defiant disorder. And that's when mostly younger kids, 12 and under, we diagnose with that. And that's kids who have trouble with following rules, authority, things like that. And so those, I would say, are the four most common.
Okay.
We have a lot of parents ask us, is my child bipolar? And bipolar is one of those diagnoses that we try to wait until very late teens, early 20s to diagnose, because a lot of what could possibly look like bipolar disorder can also be hormonal changes or just going through maturity and things like that. So most are very hesitant to diagnose with bipolar disorder until a person reaches more towards early adulthood.
Okay. And I want to go back for just a second, because you mentioned two things that I want to spotlight for just a second. The first was suicidal thoughts. And I just want to say here to our listeners or our viewers that if you are having thoughts of suicide, I want to let you know that there is hope and there is help out there. I understand that you are in severe mental and emotional anguish right now. And so there is hope. There's a national suicide hotline that you can call, 1-800-273-8255. Or if you would rather have a text conversation, you can text 741-741. And so those resources are available to you. And so what I'm asking you, as a mom and a nurse and someone who cares about you, is to not disconnect and not to isolate. There are people who care about you. Your life matters, and we want you to hang in there and to get help. Suicide is not the answer. So stating that and just giving those references real quick, I also want to go back to something else that you stated, because this is pretty prevalent, especially among teenagers, is this self-harm or non-suicidal self-injury is how it's also sometimes referred to. And Leslie, I know that the very last thing to do if we recognize that one of our children is having non-suicidal self-injurious actions like cutting or burning, pulling their hair out, pulling eyelashes out, is to tell them to stop. And that seems counterintuitive. It seems like the first thing that we would want to do is say, stop harming yourself. explain to us why that's not the right action, at least initially, and what is the right action for a parent or a loved one or friend to take if they recognize that a child or a teen is self-harming themselves.
Well, the very first action I would say is to seek out a professional to help guide you through that journey, because it's not a one day thing. So when kids have reached a point of hurting that they're thinking about hurting themselves or even may have tried it, you're going to want to reach out for help with that. But then as a parent, what they're really needing is for you to acknowledge that you will try to understand what they are going through, that you understand that they're hurting, that their feelings are valid, that what they're going through is real, and that they're not alone. And I think that that's one of the most important things for a parent to do. A parent's first reaction is oftentimes to yell or to punish or to tell them to stop. And I understand as a parent that it would be a devastatingly scary thing to find out that your child is hurting themselves. But if your child is hurting themselves, it's not for no reason. And so what they need is they need to be supported and loved. And you need to tell them, I am here for you in those moments that you're feeling that way. I want you to come to me. I want you to wake me up in the middle of the night, or I want you to reach out to me when I'm busy and say, I need you to stop. I need you. And I think that that is what has to happen first before we have to have the hard conversations about what can I do to make you stop this, which is also very important. But they have to feel supported and understood first if they're going to feel comfortable coming to you about it in the next days, weeks, and months as they heal.
Okay, fantastic information. Thank you. Um, this is kind of a generalized question, but and it may catch you off guard a little tiny bit and cause you to dig down deep creatively. But um, as a therapist, as someone who has um, counseled and assisted so many people probably over the last 16 years, what are maybe two or three of the biggest things that you would say to maybe adolescents, teenagers or adolescents, or their parents who are listening right now that would give them hope in whatever it is that they are walking through today or in the days to come regarding their mental health? Give me some of those things. Give them some of those things that would give them hope, Leslie.
Well, one of them I'm going to steal from a patient that told me this about 2 weeks ago. And she said that she had a light bulb moment. And her light bulb moment was that there are unlimited number of coping skills out there. And I thought, wow, that's a neat way of saying it. And she said, what I think I finally decided is that if I haven't found one that works for me yet, it just means that the right one's still waiting. And I thought that is so beautiful that she's reached a point in her journey where she understands that those coping skills are unending. And if you don't know what a coping skill is, a coping skill is a way to calm down, a way to help ourselves, a way to distract ourselves, because not every problem has to be dealt with at that very moment. What has to be dealt with at that very moment normally is calming ourselves down and getting ourselves to a point of thinking more clearly so that we can handle the problem later. And so a coping skill can be as simple as going for a walk, reading a book, listening to music, or saying a prayer, reading a verse of scripture. And so I think that's my first one. And I steal it from a patient from 2 weeks ago. Coping skills are unlimited. There are unlimited numbers. The second one I steal from a movement that's going on, which is the semicolon movement. And a lot of people are getting a semicolon tattooed on them, or they're wearing them in support of either they have thought about suicide and have decided not to, or they are supporting people who have thought of it. And it's a movement that really says, just like a semicolon is in a sentence and there's a whole sentence, but then there's something later. And it's really meant to say that there's always something that can come after. There's always something that's going to happen. And that's what we really try and encourage our patients, whether they're in the hospital or in private practice, that life is just beginning. There is always something new around the corner. And some of those new things are going to be great, and some are going to be okay, and some are going to not be okay. And even in the not okay moments, we can learn and we can live and we can love, as you were talking about those ideas earlier. And so I love the semicolon movement for the amount of hope that it gives it. There's always something that's going to come after.
Yeah, absolutely. That's fantastic information. And I think too, it's important to emphasize that there's not really a one size fits all regarding the treatment for a mental challenge or a mental disorder. Oftentimes, it takes a combination of many therapeutic modalities out there. It may take medication for some, medication may not be necessary for others. Medications also have to be changed as far as the dosage, as far as the type medicine being given, and as far as the combination of medicines. Seeing a licensed professional counselor like Leslie is helpful, even going another step and seeing a psychiatrist to consider medications, a prescriber that can prescribe possibly medications that may assist, and then figuring out, like Leslie was talking about, what combination of self-care strategies can be implemented to help you deal with anxiety or depression or whatever mental health challenge that you may be facing. And so I think all of that's important. One more thing I want to ask you about, and I ask this because I've been in conversation with a parent regarding this over just the last week. Um, it may not always be the parent who is the best person to have a conversation with. Is that a true or a false statement, Leslie?
That's definitely true. It's sometimes it's too close to home for the parent. Sometimes the parent is dealing with their own stuff at that very moment. And so sometimes a child or an adolescent may be reaching out to an aunt or an uncle. They may be reaching out to a youth pastor or a Sunday school teacher. They may be reaching out to mom's best friend, that they've grown up with, like a second mom their whole life. They may be reaching out to their friends. And so that's where parents have to try an open flow of communication with their child's friendships, and letting friends know, that they can call you as well when they need to. I can't tell you the number of kids who have come into the hospital because they called their friend and their friend called for help. And so, as a parent, even if your child is not suffering from mental health problems, you can be an encourager to your child to be that person that reaches out for help for their friend, because that may be the only person they're talking to.
Yeah, and I can say now I'll put on the parent hat. As a mom, I can say that was very difficult when our children were still in the home, because I wanted for Philip and I to be the go-to people. We have such a close and loving relationship with all of our children, but Philip and I realized very quickly in dealing with some of the difficulties, especially as our children became teenagers, that we were not always the best person to dialogue about particular situations. We were so emotionally charged maybe at the time. And because of that, it's like pouring gasoline onto a fire. It just ignites things even more. And so parents, I want you to hear the fact that that's not a parental failure on your part. If your teenager is asking to talk to someone besides you, it's actually a good sign that they're willing to reach out and talk to someone else, a coach, a teacher, a guidance counselor, a friend, as long as you know that friend is someone who's going to give them helpful, constructive input and not destructive input. So you want to put boundaries as far as that goes and be aware of, if it's a peer, what type peer your child is talking to. But so I want to speak that encouragement into parents right now, not to find that as a failure if your child is talking to someone else. And then the second word of encouragement that I would give as a parent is, please do not minimize the importance of seeing a counselor yourself, especially if there is a substance use disorder involved with your teenager. A substance use disorder, we have not talked a whole lot about that, but it's one of those other things that can be very prevalent and is becoming more and more prevalent.
Mhm.
Even as in child population as young as the age of 12, right, Leslie?
Yes, and actually not necessarily in teens and kids right now, but inside of this COVID that's going on, we are seeing an increase in substance abuse with college age and young adults, and even adults struggling with too much free time on their hand, too much worry about the future. We kids who were just graduating from college and thought they were going to have a job and they don't right now, and they're turning, unfortunately, to drugs and alcohol to numb that. And so it's a very, very prevalent disorder right now, among what we've been going through with the COVID virus.
Okay. And so reaching out to a counselor or someone that you can talk to is a very good thing surrounding that topic of substance use disorder, because that has a tendency to implode the entire family. It affects siblings, it affects the parents and the whole dynamic within the family and all of those relationships. And so, again, don't see reaching out for therapy or to talk to a counselor as a weakness, or like you're broken and need fixing. We all need someone, a safe place, and someone to talk to every now and then. And so please know that you need to do that as well as your teenager sometimes, to have someone constructive and not as emotionally spun up, that can just give you helpful information in the moment. And that will actually assist greatly in conversations and in relationship with your children as well. And so I want to emphasize one other thing, and Leslie, you may want to address this as well, but according to the National Council for Behavioral Health, they say that having one significant person in the life of a child or a teenager is the most important protective factor
Mhm.
regarding the mental health, or just supporting someone, a child or a teenager who is dealing with some aspect of their mental health. And I agree with that. Would you expound on that any for us?
I definitely believe that having one significant person that a child feels close to, feels loved by, and they love, and feels a connection with can make all the difference. There have been multiple studies done that show that that is a huge protective factor. And adding to that one person that they feel close to is all you're doing when you add a therapist to help you in your journey. A therapist is not there to take the place of a parent or to take the place of a sibling or a teacher. A therapist is there just to add to your life experience in a positive way. And what we find in research is that when a unbiased, unrelated party gets involved, when someone doesn't have an emotional connection or someone doesn't, deal with them and talk with them in everyday life, it's just that quiet, confidential time alone where we're totally allowed to be selfish and talk about ourselves for a little while. And we all can benefit from that even without mental health diagnosis. People have shown great benefits of going to counseling, for just personal growth as a person, but as well as for the treatment of mental health disorders.
Okay, fantastic information. And I'll popcorn again off of one word. that you just mentioned that I want to emphasize. You mentioned the word confidential. And
Mhm.
so just for the viewers and the listeners out there, if someone close to you, a friend or family member, says that they are having suicidal thoughts, that is the one time that it's okay not to keep that information confidential. You want to tell people close to that person and begin to form a safety contract with that person, develop ways with that individual in order to be able to keep them safe. So know that all rules about confidentiality go right out the window if if the word suicide or homicide enters the picture. So don't worry about confidentiality and trying to keep folks safe in
Yeah.
the context of their mental health.
Right.
Anything you want to add to that, Leslie?
I have parents that ask all the time, well, would you send them home with me if you didn't think they were safe that day? And I always reassure parents I would never send someone home that I felt like was fixing to hurt themselves. I would break confidentiality at that point, and I would encourage a safety plan, or even if I was very concerned about imminent danger, I would encourage hospitalization. And something that you talked about earlier, families are sometimes very afraid of going to a therapist or going to a hospital because they think that automatically means medication. And I just want to be an encouragement that medication is good for certain times and certain situations. But we have kids and adolescents all the time that come into the hospital and come into my private practice that are not on medication and that don't leave on medication, that they just need the counseling aspect, the coping skills, the learning hope, and that is sufficient. And so I don't want families to feel like that's immediately going to be done, even if it's not needed, and have fears about reaching out to professionals because of that. Again, I will say there are really great medications, and when prescribed correctly and used correctly, they can be very helpful in the right situations. But that is not something that always will occur.
Right. The National Council also says the statistic is out there that of the folks who have a diagnosable mental health disorder or challenge, only about 50% of them actually reach out for help. And of that 50%, oftentimes they wait as much as 10 years
Mhm.
before waving the white flag and saying, something's wrong here and I need to get help. And so I give that information to the parents again listening to encourage you that when in doubt, talk to a professional, crack the door, and begin to ask questions regarding your child or your teenager in order to be able to take proactive care. I guess I go back to what our journey with our oldest son Philip. We never in a million years would have thought, even myself as a nurse with over 35 years of experience, I never thought about there being a mental health component to what Philip was walking through. We now believe and know, based on things in his journal and conversations with him before his death, that he was self-medicating with the substances that he was choosing to use to try to treat some of the things that he was dealing with in his mind. And so I want to encourage you that if you are in doubt, or if you're just wondering now, based on some of the things that you've heard Leslie and I talking about today, that there's a question mark there, that maybe you want to talk to somebody and say, hey, I'm thinking maybe this is a possibility, then I encourage you to go ahead and step through that door. One of the things that preempts that is stigma. Nobody likes talking about mental health. But let me ask you this. If you had a fever of 103, severe abdominal pain, and were vomiting for the last 24 hours, how quickly would you pick up the phone and contact your primary care physician or go to the emergency room for care? Your brain is another organ in the body, just like the liver, just like the heart, just like the lungs. The brain sometimes gets sick and needs attention too. And so that's one of the main things that Overflow Foundation is trying to do, is to punch our fist through the wall of stigma so that people will know that it's okay not to be okay. And it's okay to reach out for help and say something's not right and I need to talk to someone. So I want to encourage all that with that today. Please don't wait. Step through the door, crack that door, and just begin conversations today. Leslie, we're going to close up because I think we've been on for about 40 minutes, and I know we're probably losing people who hopped on earlier, but tell folks how they can access you. I know you're in private practice now as well, and this is a common question that I get. Who out there is doing child or adolescent therapy? Who can I find help with? So tell them how they can access help.
So the way that you could access me, I am new to the private practice arena, but I am practicing at Southern Counseling Associates over in the Woodside Executive Park. And so just Google us. I actually wish that I had a card right in front of me, and I do not. Actually. Yeah, I do. Hang on.
Okay.
Because I'm sorry, I'm so new. I don't even have my phone number memorized yet. Isn't that terrible? But it's 803-440-0274. And so it's Leslie at Woodside Executive Park at Southern Counseling Associates. The other way is through Aurora Pavilion. And Aurora has a phenomenal thing called Respond, which is a 24-hour-a-day intake line that's completely free. You get a free evaluation for anyone ages 5 and up to 105. And all they have to do is call Aurora Pavilion or just come to Aurora Pavilion. If it's an emergency, just come. And we are still seeing patients amongst this crisis that's going on all over the world right now. We are doing our very best to keep the hospital very, very safe. And so you can rest assured that we have not had any problems with the COVID outbreak at the hospital to this point in time. And so they are more than welcome to come and ask for Respond. I also want to tell parents about a resource that I found. If you just go online and go to the American Academy of Child and Adolescent Psychiatry, they have a wonderful resource, and it's called Talking to Kids and Teens About Coronavirus. And it's got about 10 links. And it's saying, talking about it, helping kids cope, fast facts for families, questions about it with clear answers for kids. And it's a really great resource. I've been reading through these over the last week, and I've been very impressed with this website. So it's the American Academy of Child and Adolescent Psychiatry.
Okay. And for slow writers, state your phone number one more time, Leslie. And then if you'll send me all of your information when we're done today, I will post it on the Overflow Foundation website and on the Overflow Facebook page so that folks can access you as well if they're like me and can't put their hands on a pen right now. So state your phone number one more time.
It's 803-440-0274.
Okay. And the name of your office, your private counseling office?
Southern Counseling Associates. There's actually 3 therapists that practice there. And so if I'm not able to see you, one of my associates would. And then we have 2 of us that see kids there and one who sees adults.
Okay. So. Okay. That's excellent information. I can't thank you enough for taking time out of your holiday weekend and family time to be with us today. Mental Health Community of Hope, this meeting takes place once a month on the 4th Sunday of every month. We typically are in person at Cedar Creek Church, the Banks Mill campus of Cedar Creek Church. It's an Overflow Foundation sponsored event, but Cedar Creek is kind to let us use their facility for this meeting. We're hoping that for the month of June, we will be back in person, socially distanced, and be able to meet in person. We'll play that by ear. I'll keep posting regarding our plan for that. If not, then we will be back here on Facebook. And my plan moving forward with Mental Health Community of Hope is to now have it both available on Facebook Live as well as the in-person events, because what I'm finding is some people aren't quite ready to walk through the door yet for the in-person events. And so I want to access people any way that they will give me access to them, to raise awareness and to give them hope. And so that's the goal of Overflow Foundation. So if you're trying to reach me, you can go to www.overflow.foundation and contact me via email there, or you can message me on Facebook and I'll be glad to get back with you as soon as possible. I hope that something that you have heard today, either from Leslie or from me as a nurse, wife, mama, pastor's wife, has resonated and has given you hope. As a Christ follower, I believe that apart from a relationship with Jesus, it is very difficult to deal with a mental disorder or a physical disorder, because I know as a Christ follower that our strength comes oftentimes from outside of us. And so I want to leave you with this verse, Romans 15:13. It's the key verse for Overflow Foundation. And it simply states, may the God of hope fill you with all joy and peace as you trust in him, so that you can overflow with hope by the power of the Holy Spirit. So I'm praying for you and available for you if I can help encourage you in any way through the foundation. I hope you have a great holiday weekend. Leslie, again, thank you so much. And we'll hopefully see our viewers and our listeners again, either on Facebook or at the live event on the 4th Sunday of the month of June. Thanks so much, and happy Memorial Day weekend.